Okay, so hi everyone, welcome back to the Sliding Scale podcast. Today I have the pleasure of hosting one of my favorite juniors. I know we're not supposed to pick favorites, but I do have some favorite juniors. And Dr. Dhrithi is one of them. She was my intern when I was doing my MD medicine residency, and we had a great time in the wards. We were able to help patients and at the same time have a lot of fun, which is quite a rare combination to come by. And now Dr. Dhrithi is doing her MD Psychiatry. She is a third generation psychiatrist, and she's here to give us a little bit more insight into the world of psychiatry and what she does on a day to day basis. So, welcome, Dr. Dhrithi, to the show, and tell us a little bit about yourself.
Hi, sir. Thank you so much for that lovely introduction. To all those listening and watching, hi, my name is Dr. Dhrithi Mushti. I am a third year psychiatry resident in Pune. And what else do you want to know?
I mean, the thing that people want to know most about, I'm sure, apart from psychiatry, which we're going to talk about, is that you've had a very successful um, social media, not career, but at least social media presence. So tell us a little bit about that. How did that start? What made you want to take to social media?
So the profile actually started in 2020 during lockdown. I had just traveled back home, and this was bang in the middle of our NEET PG preparation. And the page actually started out of the blue. I hadn't really planned it out or thought about it much. It was basically just to kind of do those study challenges that some of the Marrow teachers had put up. And it was just for my own accountability and maybe, finding people who were in the same journey as I was or in the same place that I was. And that's kind of how it started out. And it's where it is right now. I don't even know how that happened. I mean, I'm obviously grateful, but I don't know how that happened. I were present since my residency started, so
Yeah, I think one of the things about social media is that it's very
yeah,
unpredictable, difficult to really understand or
yeah,
try and predict the way it's going to react to the content that you put out. So I think the key is just to keep putting it out, and hopefully something somewhere someday will click. So Dr. Dhiti, you have been in psychiatry for some time now. What do you feel is a common misconception that people have about psychiatry?
okay. There are so many misconceptions about psychiatry. I think one of the most common things for psychiatrists that we face is people think that we are just waiting here to psychoanalyze them and read their minds. We're not. We don't get paid enough in our job to do that, so we're not definitely not going to do that for free. Another thing that we face that's very common is that people think that psychiatric medication or psychiatric treatment is addictive, and that once you start medication you can never stop it, or that you're going to take it for the rest of your life, which isn't the case. A lot of times, yes, there are some medications that are addictive, and we have to prescribe them very carefully, and that is a certain class of drugs, but that's not true for everything else. And that is something that I think people need to understand, because even people who are educated and have a lot of awareness about these things and about the field in itself, they still think that this is something that's going to happen and that they might get dependent on these medications, which is not true. So I think that is something that I would probably want people to know.
Yeah, I think that's actually the first time I'm hearing about it, and I never really thought about it. And I think you're right that fear of the medications is something that's so prevalent. And even as a general physician, I get so many people who have panic attacks, and they get referred to me because they have chest pain,
Right.
palpitations. And once I've ruled out all the organic causes, and I tell them that okay, this is not an organic thing. You definitely need to go and see a psychiatrist to deal with your underlying issues. The first reaction that I get is, if I go to them, they will automatically start me on medications, and I'll never be able to stop those
Yeah.
medications. And that fear is
Yeah.
real. And even though people happily take medications for diabetes or hypertension, and they've sort of accepted it, people
Yeah.
have a lot of difficulty in accepting
Yeah.
that they have to take medications for their mental health issues as well.
Absolutely.
So while it's
Absolutely.
while it's rapidly changing, and there are a lot of new ways in which mental health has become more accessible to the general public. There's still a lot of taboo surrounding psychiatry, and what do you feel that healthcare workers can do to change this taboo?
Okay, this is actually a really important question and also something that's very difficult to answer because, okay, we all know that there's this huge stigma against psychiatry and mental illness. But when it comes to healthcare workers, I think first and foremost, I think it's important that healthcare workers themselves understand what psychiatry is or what mental illness is. Because when you don't have that camaraderie, you don't have that understanding within your own fraternity, then you can't expect the common man to actually understand what mental illness is. There are so many people within the fraternity who still psychiatry as a subject or don't believe that it is important enough to treat or give it much importance. So that makes things a little difficult because it's so easily disregarded and so easily misunderstood. And people are so happy to refer their patients to other fields of medicine, like for example in general medicine, your patient to endocrino, you'll send them to cardio, you'll send them to surgery, you'll send them to all kinds of fields. But the minute it comes to psychiatry, there's either this huge worry as to what's going to happen, or there's this complete disregard where people don't really care, like, oh, it's a psychiatric illness, and let's just send them. Like, if they don't get a patient to cooperate, they'll just be like, oh, call the psychiatrist, they'll come and counsel the patient. So the value of what we do or the value of the subject is so I can't explain it. It's not given the kind it should be. So that is something that's very important, where I feel like other physicians know that mental illness is just as important as any other physical illness, that people should be taught how to interview patients during their evaluation as well, that you don't have to do a full psychiatric workup for the patient. I understand that that's our job, but to spend a little time to kind of understand the patient beyond just the 4 symptoms that they've walked in with, that they're not just their illness that has walked in with, that it's an entire person, and that these things have to be evaluated beyond their current complaints. I think that is something that's important, and people are taught that from early on, like from MBBS onwards, then that makes a huge approach to patient in the end, and how they would refer patients out or how they would treat patients.
I think I myself have been a little guilty of, being reluctant to, refer patients to psychiatrists, especially as a resident. As a resident, we were lazy, and it just seemed like another opinion that we had to get. And unless and until there was a pressing reason, like someone was going, actually going out of their way to make life difficult for us, we usually were fairly reluctant to get psychiatry opinions on an inpatient basis. Maybe on an outpatient basis, we were a little bit more okay with it, but you're right, on an inpatient basis, we were definitely reluctant to get opinions. But I think that has drastically changed for me once I've come out to private practice, where I see so many more, prevalent cases of people having mental illness with just no idea that it's causing physical discomfort to them. And yeah, I think awareness is one half of the battle, but the other half of the battle is actually taking the effort to go find out who the psychiatrists in your area are, and being able to refer to them is definitely work that needs to be put in from the medical fraternity. So I think I'd like to delve a little bit more into your professional day to day, because in medicine, when I treat patients, I a lot of times feel like I've not really cured the patient. I just feel like I've maybe helped them manage their symptoms a little bit. And I assume that that's how it is for you guys as well as psychiatrists. Uh, and please correct me if I'm wrong, but when you have that frustration, how do you deal with it?
Honestly, right now, I think when we took up psychiatry, I think we knew that this came with the territory, that the managed plans and all are extremely long term when it comes to psychiatry. And while the job satisfaction when a patient is fantastic, but a lot of the times they don't. A lot of the times, there's only some level of response beyond which you will not see much happening. And initially, we used to be really frustrated. We used to be very upset and emotional about these things. We always felt like we were doing something wrong and we weren't doing enough for our patients. But I think over a period of, I don't think I'll be able to tell you exactly what we do to be better. But over time, we've come to realize that we can't change everything, and everything is not in our control, and we just have to do the best we can for our patients. And that, I think, is common to every branch under medicine. We just do the best we can and hope for the best for the patient. But beyond that, there's not much that we can do. So frustration, honestly, I think, at least as a resident, we just went to our co-residents, or we just talked to our faculty and tried to deal with these things on our level. But beyond that, there's not much. Just do the best we can for the patient that we have, and
Yeah, I
the
think an
resources that we
important
have.
thing that you mentioned was that you need to have that support system within your own fraternity to be able to cope with things like
Yes.
not being able to treat your
Yes.
patients. Sometimes you would have put in all of the efforts that you could have possibly put, or within the
Yeah.
resources that are available to you, you would have
Yeah.
done everything. But still, patients will not have the kind of response that you were expecting, and at that time, the support and
Absolutely.
understanding of your fraternity makes a
Absolutely.
huge difference. Um, so
Yes,
moving.
understanding your limitations is extremely
Yeah, no,
important.
definitely, please.
Sorry.
I think understanding your limitations and just being aware of what are the possible things that you can do in the setup that you have is sometimes, of course, it's very demotivating and discouraging, but at the same time, I think it makes
Yes.
us much more effective as clinicians
Yes.
to be able to understand what we're working with and provide care around those resources. Um, Yes, so that
Absolutely.
awareness is definitely
Absolutely.
critical. So I think one of the things that I found very interesting is that I have met doctors who are third, fourth, fifth generation, and I feel like their whole perspective on medicine, on healthcare is very different. So as a third generation psychiatrist, how do you think that has affected your perspective in the field, or your approach to your patients? Do you feel like it's different from other colleagues of yours who are first generation?
I'm not exactly sure if it's very different from what my colleagues have faced. I assume it is. But being a third generation psychiatrist, I mean, it has its pros and its cons. The pros being that I watched my mother work her entire life. I've grown up in her clinic. I've worked in her child clinic since I was 6, 7 years old. I used to teach the other children who need special kids, special needs children, the alphabet and numbers and all kinds of things like that. And I've been exposed to this from a very early age. So maybe in some ways my approach could be a little different. I'm probably wasn't very scared of aggressive patients, or I knew what to expect when I got into this field, which is probably not the case for a lot of people. But other than that, I think we all kind of learned on the job. I mean, a lot of people come from a family of psychiatry, mere khoon mein hai, and it gives me an edge over others. But when it comes to the work, when it comes to the studying, it doesn't. I may have had a little more exposure than some, but you know, the amount of work that goes into this is pretty much the same. So that I don't think is very different. And the only edge that I probably have is the fact that
Yeah.
I knew what I was getting.
Yeah, I think that advantage is definitely something that I don't know if saying that it gives you an edge is the right way to phrase it, because it makes it sound like you have some kind of advantage. But I feel like
Yeah.
people who are not first generation
Yeah.
doctors, the biggest place that they struggle with is they feel like they dove into something head first which they didn't really understand completely. And I feel like maybe those
Right.
initial stumbling steps
Right.
weren't there for you, and for, of course, all of the other people who come into medicine or come into a specialty with parents or grandparents who have been in the field. Now, is that maybe there isn't as much of a
Yes.
culture shock when you come into the field?
Yes.
Things seem
Yes.
slightly a bit more familiar. Of course, the
Yes.
coursework and the day-to-day stuff is just as hard, if not harder, for people like that, because they have standards and other bigger
Expectations
shoes
are high.
to fill. So definitely in that aspect, it is slightly a disadvantage. But yeah, I think yeah, that's definitely good insight for me. I guess I'm thinking about my kids and if I want to ever put them into medicine. Um, but so far the answer is no. I would never voluntarily put anyone into medicine. So you deal with patients with a spectrum of clinical presentations. And do you ever feel like they come back to who they were, pre-illness, or is it just that people find a new baseline and sort of accept it and go from there?
So it kind of goes both ways. There are a lot of patients who go back to SED and we have to start all over again with them. But that has so many factors associated with it. There's like non-adherence to treatment, and there's poor social support, and all kinds of things that play in a patient going back to their pre-illness state and having us to start over again. But yeah, there is something called the new normal where you have to kind of understand there may be a new baseline, or there may be a point from which we have to go forward, and we may get stuck at some point. But that's actually a little confusing, because in psychiatry especially, there's no such thing as normal. There's no such thing as baseline as such. So that's where things get a little difficult. Yeah, I mean, we kind of have to accept that and see what we can do again, do what's best for the patient from that point on, if they do come back to us. We hope that they don't. We try to educate them, maybe we try to educate the family about the nature of their illness, the prognosis, and all of that. We try to tell them as much as we can to make sure that they stick to the treatment and they come for their follow-ups and do all the right things to make sure that they don't relapse or they don't fall ill again. But even then, sometimes, like I said, things are out of our control and we can't do much about it. So we kind of have to pick up from where we left off and do the best we can.
I think the biggest takeaway for me was that, like you said, in psychiatry there is no normal, and I feel like even in life, like in general, there is no normal. It's just a bunch of rules that we make up for ourselves, and then go crazy when those particular rules, those arbitrary rules, are not met in any way, shape, or form, which I think is crazy sometimes.
Exactly.
But I think I'd like to bring the conversation a little bit closer to home, because a lot of people in our field, especially as I become a little bit more senior, a lot of juniors have approached me and told me, like, they're dealing with a lot of toxicity in residency, in internship, and I always not hesitate, but I do tell them at some point that you have to figure out if it's too much for you to handle, and you have to seek professional help. And I'm sure you have also come across people like this within your own fraternity and like your extended circle of friends. But in your opinion, when do you feel is that point where doctors or healthcare workers in general should seek professional help?
Okay. I think the point where people should seek professional help is the minute they realize that something is wrong. When they realize that they're not able to handle it, and when the thought even in, that is when you should seek professional help, because otherwise, if you were able to handle everything on your own, this wouldn't even come up, right? And when it comes to residency, I mean, I can't comment much on the city, because it does come with the territory, it does come with the field we're in. The workload, the crazy erratic hours, the sleepless nights, the lack of sleep, right? Lack of food, all of that kind of comes into play when we're in residency, and everybody deals with different levels of that or struggles with that in different ways. But the fact that you have resources now, you have psychiatry residents, you have friends in the field, who can help you through this. You have access to so many online resources where you can get therapy or psychiatric help. I think you should use these when you feel the need to. The point at which somebody should, I still believe, is the minute the thought comes in that I'm not able to handle this. I think, I need a little help. There's nothing wrong in seeking professional help. You would do that if you felt sick. You would do that if you had a cold. You would just go to your friend who's a medicine resident and say, "Yaar, mujhe ye prescription de do." So why not go to a psychiatric resident and just ask for just even, just to sit and talk it out and see what best you can do to go ahead. So I think, again, in this sense of self-reflection, just to see where you actually stand and understanding whether you actually go ahead on your own or whether you need a little extra help.
Yeah, I think the thing that people struggle the most with is to make peace with the fact that they cannot cope with whatever it is that they're trying to cope with. And so, like you said, I think that's the point when they should be seeking help when things start to go wrong. But it takes so long for us to accept that, that this is a battle that I have lost and I need to find help so that I can get past this. And I feel like with physical
I don't even think I would want to use the term battles lost, because that again is a little self defeatist, I think. It takes immense courage and immense strength to actually pick up the phone and ask for help or pick a paper and walk into a psychiatry OPD. So it takes a lot of courage for that. But, needing a little extra help in the journey, there's nothing wrong with that. So maybe that is what people need to understand, that it's okay to want to get a little help, okay, want to visit a psychiatrist and try to work through your issues. Not everything is about medications, not everything is about a therapy session or anything like that. Sometimes just talking helps, sometimes just talking to a complete stranger who has no idea about it, sometimes up to that person, because it's a judgment free zone. Maybe that is what actually helps them come out of difficulty or helps them through that struggle.
Yeah, you're right. Maybe thinking about it like a battle is not the best way to think about it, simply because it already implies that there is some sort of loss that's going on, and that's not necessarily the best place to start when you're looking to get some help. But I think from personal experience, just talking to people when you are feeling down, when you feel like you've hit a wall and you're not able to push through a certain problem, does do wonders. And it's a little sad that we don't have more opportunities to talk to people like that without the fear of judgment being passed, or without the fear of worrying about the consequences of opening up in that way. But yeah, I hope that people listen to this conversation and it reaches the right kind of audience, and people do come out and at least talk to you, or me, whoever they feel comfortable with. But so, Dhrithi, you've had a successful, or I mean, successful is very subjective, but in my opinion, you've had a very successful social media presence. Do you feel like it has impacted your career or your professional life in any way, or do you feel like it's just something that you do for fun, or something that just makes you happy?
I haven't had much of a presence in the last 2 years since my residency began, because work kind of took over and I couldn't get myself to make any kind of content. I honestly right now I don't even know where my page is going or what I want to do with it. But yeah, I mean, when I started out at once that I got from my page or the work that I put out, it definitely improved my confidence. It was something, being on social media is a huge no for me. I'm very, very scared of, I don't even know how I'm doing this right now. So for me, being on, like starting my page and actually putting myself out there was a huge boost in confidence. Not sure, I think I'm kind of reserved, a little scared about what might happen or what people might think, and I am a little worried about the judgment because I don't know where my page is going. But overall, I think it's been an amazing. I love the fact that I was able to get myself to do this and take it as far as I have so far. And yeah, I mean, I do want to continue. I do want to see my page go somewhere. I do want to like make change and something new. I don't really know what I'm going to do right now, but yeah, I'm excited.
Yeah, I think people should get an idea of how busy you've been, because Dhrithi was the first person I approached as a guest for this podcast, and I think we are now like four guests in, and finally I've gotten Dhrithi to be like, okay, you know what? Let's just get it over with, because you've been annoying the shit out of me for the past like 8 months. Let's do it. So Dhrithi has been super busy in her first 2 years of residency, as she should be. I cannot imagine a medicine or a surgery resident taking time out and doing this. So thank you for taking the time out finally. But so the last question that I have for you before I let you go today is, what is the one piece of non-medical or non-pharmacological advice that you feel has helped your patients the most?
Okay. This is a little difficult because in psychiatry, every piece of advice is medical advice. Um, but I think reaching out is something that's very, very important, that we always try to, tell everybody around us that if you need help, don't shy away from reaching out for it. Whoever it may be, it can be a family member, it can be a friend, it can be a professional, no matter what the issue is, no matter how big or small you think it may be, just to reach out. That makes a world of difference. And yeah, other than that, I'm not quite sure how to answer that question anymore, sir.
No. I mean, it was a very subjective question. I don't think there is one right answer or wrong answer. I mean, of course, reaching out is something that's incredibly important, and I wish that there was some way where we could hammer that mentality into people that it's okay, whatever it is that you're going through, just reach out, whether it's to your family, to your friends, or to even strangers if you have that kind of confidence. I think a society that is able to inculcate that in their youngsters is going to be a successful one. Unfortunately, we are not fantastic at it. We're still getting better at it. But yeah, hopefully in the coming years, we will have a much more mentally sound generation that comes up after us without as much trauma.
I hope so.
Yeah. So that's it, Dr. Dhrithi. We are at the end of our show today. But before we go, did you have any closing comments or concerns or anything that you wanted to say to our audience?
To all the people who want to take up psychiatry, I just want to tell you that people are going to say that psychiatry is a very chill subject and you have a very cushy life ahead. It's not. Unless you're extremely passionate about this subject, do not take it up. It's very mentally taxing, but it's a beautiful subject with so much scope and so many beautiful things that you see every day. There's never a dull moment in this field. And but it is just as grueling as any other subject when you take it up as a resident. And if you want a chill, happy, cushy life, think about that 2 years down the line, not right now. But otherwise, psychiatry is a beautiful field, and I really want to take it up if they're really, really interested.
That's awesome. Yeah, that was supposed to be a question that I asked and I completely forgot, so that's my bad. I'm so sorry. But thank you anyways for coming and reminding me and talking about it. But thanks so much, Dhrithi, for taking time out today. And I hope to have you back as a guest in a couple of months. So be prepared.
Thank you so much for having me. Great pleasure to be here. Thank you.